Hey, Daniela. So I'm going to do a few different videos talking about your question. So you asked, how does the rib cage shape influence shoulder pain? That's such a good question. I would say that it's a complex question, but it's so good. I would say that someone's rib cage shape influences everywhere. So if somebody has a breathing pattern imbalance, a core imbalance that then impacts the rib cage, which I'll show you in a second, it's going to affect your center of gravity. It's going to affect compensation throughout the body and also in the shoulder. So I will answer your question, and then we'll go into deeper on the 17th, how your rib cage can impact everywhere in the body and how center of gravity can impact everywhere in the body and yada, 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 yada. So let me go over one of the more complex and very common imbalances of rib cage. So I guess, okay, so there's one that's really common, so easy, and that's just the double rib flare, where somebody just can't properly exhale and their core's weak and long, and it's like the classic, like, over-dominant back, weak core, tight chest, like tight lower chest, weak upper chest, yada, yada, yada. Lordosis, tight quads, tight hip flexors. Like, that's a really, really common one where you just see a double rib flare. And we'll go into that too. That one's easy though. The more complex ones are where you have kind of a unilateral imbalance, and that's one I want to talk a little bit about. So I see it in a lot of clients. Not all, but a lot of my clients that'll have one shoulder that's lower than the other. Most common, it's their right shoulder. So, but I've seen it in the left, just not very often. So if the right side is lower, and the left side would then be higher, you'll also see, like, you have to have them pulling their shirt tight, maybe take a few pictures, have them walk. Like, you don't need to explain it to them right away. You don't even need to understand it right away, because everybody's going to be different. But kind of get some movement. I prefer walking and standing postural analysis, and then I just analyze every single movement pattern. Like, I don't necessarily align with one particular testing strategy, because when it comes to neuromuscular connection, someone can pass one test and completely fail another. So I like a more active and engaged assessment, where I'm just kind of always watching my clients for these little things, because one day may be different than another day. And so I like walking, and I like standing, and I like squatting, and I like shoulder press, and I like rowing, and I like everything. I like pushing. You'll see some minor tweaks between a push and a pull and a squat, because there's so many facets to just how people move. So I don't want to overwhelm you, and we'll talk more about that on the 17th. But my favorite way to analyze is just get them standing, look at how their body is in more of a static position. I like squats, shoulder press. You'll see if your analysis is correct when squatting or standing or walking, you will simply see that reinforced and confirmed in a lot of other movement patterns. So it's like checking your work, checking your work, checking your work, looking to see if there's anything new. So here, with this imbalance here, the right shoulder being lower, the left one being higher, you'll often see that their rib cage is rotated towards the left. If this is compressed, that's an internal rotator, which your external obliques here rotate you towards the opposite side. So if this rib cage is nice and tight, you don't see a rib cage flare on that right side, but this left side you do, because that is very common. That's how it presents itself. Then what you're really looking at here as to why the shoulder is lower and the shoulder is higher is this is compressed, external oblique is strong here, rotation towards the midline or internal rotation. And then on this side, you're gonna see the lack of counter internal rotation or core anti-rotation here. You're going to see a stuck rotation to the left. You'll see this rib cage flaring up. You might even notice like you can get your fingers underneath that rib cage, and this side you can't even get, you know, it at all. Even in a static position, like they are tight, they are holding that core to keep their center, they're fighting something. So, and then on this left side, you'll see this lat having to overcompensate because this rib flare is tight, or sorry, this rib flare is up and then this is looser. See this being tighter often, this being tighter, and then often shifting to a more dominant right glute. There, here, we'll go here, often have an internally rotated pelvis with that back arch. Those would go together on that left side, but it would definitely be because of this internal rotation here. So looking at this side, you can't just split the body in half and say, oh, my left side's doing this and my right side's doing this, so we're just gonna split all the workouts. Absolutely not. Because if this is tight and this is internally rotated and this is arched and this is causing this and this, or vice versa, this is causing this, and then this would also be because of this and this. This could be a compensation pattern here, or if this is really tight and someone's chest breathing on this side, that could also cause this, which would then would subsequently cause this one to have to overcompensate. So that's a little complex of a thought, and it's good to think about, but it's the theory of the chicken or the egg, which often we'll never know which one came first. It also doesn't matter. When you look at somebody's imbalance, you try to navigate, you can get lost in the weeds, and you know that, and I know that. So just kind of having pictures and videos and something standing in front of you is really helpful. And I want to explain all the nuances so you kind of get an idea to know like, oh, this is overly internally rotated. This is arched. This, you know, they shift to the right when they squat because this one doesn't have external rotation at the bottom. So they'll go here, they'll go onto the right here, they'll shift back to the left here because they have internal rotation on this side, and then they'll shift back over to the right because they don't have external rotation at the bottom. Things like that will be going on, but something as simple as the rib cage position and the core structure could have to do with every single one of those imbalances. So the reason why the details are so helpful is because it can bring everything together, and you can say, oh, this is like all from one problem, which is how well this core is integrating together. Because that's really what we're dealing with here. If this muscle is hypercontracted and this muscle is loose and weaker, this muscle is hypercontracted and the rib cage is compressed back here and flared up here, and then therefore open back here and closed here, we're dealing with somebody who's not properly like able to shift in and out of motions. So their rib cage will be here, compressed here, flared here, compressed back here, and then flared back here. So it's pretty, if you get like, even you can just be like, okay, left side, it needs some extension in the back. You're right, 100%. Getting, you know, during your warm up, you can get like a ball here between their knee and their rib cage, or if they're flexible enough, you can get their knee up to the rib cage and get some extension back here. Get some breathing back there. Get some extension and expansion back there between the rib cage. That will help this contract. Because if you have tension back here and you're just like, oh, we're gonna work this core muscle. Well, these muscles back here have internal tension, which is gonna make it very difficult to get this rib cage to come down. Because again, these muscles don't have the same strength these ones do. And then this one is going to be the opposite, to where if this is so tight and that internal rotation is so dominant, you're going to have a hard time getting that external rotation. That connection to the glute, external rotator over here, and extension over here. So then doing, of course, like some rows on that right side, working on exhaling, getting that lat to develop and pull down, getting that low trapezius muscle on this side to develop and pull down, working on compressing this and getting this to lengthen. And then of course you're going to have to do lots of like breathing back here and shoulder press, keeping this nice and tight as opposed to allowing it to flare every time you do a shoulder press, keeping this tight, pressing up. You'll, have similar problems up here where this is going to be compressed. You're going to have a difficult time getting that shoulder up without overworking the shoulder joint. You might have pain on this side if this is over compressed, because right here, when you're supposed to have rib cage support, lengthening of the core, and a nice long core that can support weight, it can't support you when it's long if you're not training it in its long state. So it'll like try to pull you forward, and then to do an overhead position means you're gonna have to go into some kind of over mobility of that shoulder to be able to do shoulder press. So getting this to lengthen, this to compress. Shoulder press, there's lots of ways I like to program that in. Standing on one leg, like standing on this leg. Like there's so many things to try to teach the brain how to manage core pressure. The other amounts I think I already explained, which is the flared in the front, that just super common, weak core, tight back, hip flexors tight, overly internally rotated position. That's really common as well. But the cause of both of these imbalances are the same, because the cause of all imbalances are the same. And it's just, how is our body gaining information from our outside world and then combating it with like our neuromuscular connection. I love like exercises like Alex Effer does, where you kind of brace your core and you do maybe some single arm pull downs to address like a lat here that's more comfortable being shortened but not very comfortable being long. And I'm fine with those like kind of strategic program changes. I think they're very helpful, but I also want my client to be put under enough pressure to where they themselves are working on like symmetry, working on how to move, like how to control their own muscle, not simply relying on my program technique. So it takes some of the pressure off me, puts it on the client, but I have to be able to explain it to them. I have to be able to help them get this muscle to turn, to lengthen, and this muscle here to compress. So maybe doing some compressing and some breathing, some dead bugs or some core, some rotation to the right here, some rows here, kind of try to get everything loosened up and activated. A really good like strategic warm-up plan, which I'll show you guys how to create. That way in the beginning of the workout, you have your rehab or your prescription. 1 minute, yes, 1 minute, I'm almost done. And then the other half of the workout, you get to go and do stuff, push-ups, pull-ups, lunges, work on explosion, work on force absorption and force production, where you get to have like just a really fun workout in a body that felt better than it did when you first came. And then continually integrating everything together. I think both are important, having a prescription plan, but then not staying in the prescription plan because your client wants to have fun. And then getting into a workout that helps get their heart rate up and have fun and build some confidence and some just some more integrated neuromuscular connection in a body that's not tight because of the warm-up. We'll work more on that on January 17th. But let me know if this video is helpful, or if it gave you more questions and it did answers, or if there's something you want a little bit more info about. I'll send you some stuff, maybe like this particular imbalance. I'll find like a video of it or a picture of it, maybe on the bone structure wise. But your question was so good. And I actually asked questions expecting people to ask me like the silliest question, like, if my knee hurts on the outside, what does that mean? Like I was expecting that, which is fine. I actually asked a question for like a trick. Like I wanted to kind of get some trick questions in there. But yours, of course, was not. So I should have known better asking you. But anyways, let me know if you need anything. And I hope this video is helpful.